In terms of patients coming in, are we seeing more millennials? That's often a question that I'm asked. I find that the millennials are coming in more for preventative care now than we've ever seen in the past. Back in the 1980s, when people were first talking about gym memberships, it was this weird thing that people were going to have health by going to the gym. It's the same thing that's now happening in the 2020s, talking about what we're going to do for preventative care. We find that patients are asking at a younger age for skin care, for preventative neuromodulators, and sometimes even for a little bit of alteration that gives more of a confidence boost. With the millennial, one of the things that we're finding that can be a problem is this filter. So everybody wants to look like their Instagram page that has a filter put on top of their face. So when they see the finest little line, they see a little smile line that's coming, one little crease over the eyebrow, the first thing they're running to is asking, what can be done for this? What can I do so I don't, quote unquote, need a filter? And so we're finding that we're addressing these concerns quite often at a much younger age. We're also finding that those who want to alter their appearance, it's most commonly for the lips. We'll find that people are asking for a little change, a little enhancement, and still looking natural, not looking weird, but just that pop when they put the lipstick on or when they find their perfect angle. Another thing that we're finding with millennials is the talk of tech neck. More and more people are walking around and they're looking at their phones down here, so they're getting these horizontal lines. And we're addressing those using a variety of things. We can use topicals, which are working great. There's a brand new topical that's going to be coming out by Skin Medica. One that we use most often right now is by Elast, and we're seeing really great changes with that just for the texture and for preventative care. The second thing we can do is use a different type of neuromodulator or Botox technique, where we call it microtox or mesotox. We're applying between half a unit to a quarter of a unit, very superficial blebs right along the neck in a wide pattern. We find that those lines tend to fade that way. You can enhance this using your fillers, so you can use superficial fillers to go ahead and improve that, and then we can maintain these results for even longer by using external radiofrequency. So we're finding with millennials, they're really ready to come up with a plan for that next year, 2 years, or even 5 years, and we're finding they're quite compliant as long as you give them that plan and send a reminder. And again, using technology, we're going to send them reminders via text, we're going to send them reminders via their Instagram page, so it pops up and says, did you remember to call Dr. Chilukuri? Are you going to go see him for your appointment? So it's a neat change that's going on with this 2020 generation.